Hello, my name is Amy Haulsee and I'm the Director of Women and Children's Services at Memorial here in Gulfport. I want to talk to you about Baby Sleep Day, which is March the 1st. And today I'm going to talk about some highlights of safe sleep for babies. So right here I have my bassinet and my baby in here, and I want to point out that nothing else is in this bassinet, which should be the same as you have at home. Nothing else in your bassinet or your crib, just a fitted sheet, no other extra blankets. Babies can be dressed several different ways. This one right here I'm showing, baby doll we have, is just in a little onesie. You can get the ones that cover their hands also if you worry about keeping them warm, and their feet. And I'll show you a couple of other items. This is a sleep sack. It's okay to have in your bed, not a loose blanket that the baby could kick and get out of and get it over their face. But what this does is it snugs them in. So when they're young, it makes them feel like they're still inside their mom's tummy. So this is really good to have, and we'll encourage you to do that. Sleep on their back a full year so that decreases their chance of SIDS. As they get a little older and they're turning over, you might try something like this that has open arms, so their arms are free, but they're still enclosed in that sack. So remember that those things are important. Nothing else in the crib, no toys, no bumper pads, no bibs when they go to sleep, no hats that they could pull down over their face. A couple of other things that we recommend: the American Academy of Pediatrics recommends breastfeeding exclusively for up to 6 months, even up to a year if they're able to. It can be breastfeeding or exclusive or milk given through a bottle that they pump. They can do that. They do recommend a pacifier use, the American Academy of Pediatrics, if the breastfeeding is well established. So about a month old or so, if it's well established, for night and for naps, having a pacifier is recommended as well. We also want to encourage no smoking in the home, babies not being around cigarette smoke, because that can be harmful to them as far as SIDS and their sleep. SIDS is sudden infant death syndrome, and there's about 3,500 cases and above in the United States every year. And the reason a lot of this is taught is because these are proven, research has done that babies sleeping on their back are less likely to develop SIDS and pass away in their sleep. The same with breastfeeding. It's recommended by them. Pacifiers recommended to prevent that. I'm Amy Haulsee, Director of Women and Children's Services at Memorial. We are Memorial.